Today I'm going to walk you through what really happens during an adjustment at a chiropractic clinic, and I'll show you the different techniques chiropractors use to help people of all ages feel better and move naturally. When someone comes in for care, the first step is always a consultation and an exam. We also take x-rays to get a clearer picture of what's happening inside the body. This helps us to see where misalignments are causing stress on the nervous system, which is often the root cause of the pain. During the adjustment, a chiropractor applies a quick, gentle movement to a specific joint, either with their hands or with a small instrument. And so this restores motion, it eases tension, and it relieves pressure on the nervous system. You might hear a popping sound, but that's not bones cracking. It's just simply the release of gas from the joint. It's similar to like opening a soda can. So after an adjustment, some patients feel immediate relief and improve mobility, while others notice a gradual change as their body starts to adapt. Even if you've had surgery in the past, chiropractic can still be an option. Chiropractors are trained to work carefully around those surgical sites and focus on the areas that can safely benefit. One of the most common things that we hear people say is that I don't want to be popped or cracked. Well, that fear is completely understandable, as we're aware that social media has blown it out of proportion. The good news is chiropractic care isn't a one-size-fits-all. There's many different adjustment techniques, and several are more gentle, which don't involve twisting or cracking at all. Our chiropractors choose the approach that fits your comfort level and your condition's needs. Here are some examples of how a chiropractor can achieve the same outcome using different techniques. The most recognized method is the diversified technique, and this is the classic hands-on adjustment where the chiropractor uses their hands to apply a quick, precise thrust to a specific joint. Patients often hear that familiar popping sound, which is just gas releasing from the joint. Athletes and active adults love this technique because it restores motion and it can improve performance. For those who prefer something gentler, there's the activator methods. Instead of relying on manual pressure, chiropractors use a small handheld instrument called the activator, and it delivers a very light, controlled tap, often with a clicking noise. And because it avoids any kind of twisting or force, this method is a favorite among our elderly patients, children, or those with arthritis. Another precise approach is Gonsta technique. Chiropractors using this method perform a detailed analysis to find exact problem areas, sometimes using x-ray. The patient's carefully positioned before a specific controlled adjustment is made, and this technique is often helpful for people with stubborn pain patterns. For example, someone with chronic neck tension from years at a computer. The Thompson drop table technique is another common method. Here the patient lies on a special table with a section that slightly lifts and then drops during the adjustment. And so the chiropractor applies a gentle force while the table does part of the work, creating a smooth correction. This is an excellent option for people who don't tolerate twisting motion well, such as pregnant women in their later trimester. For patients dealing with disc issues or sciatica, we often recommend flexion distraction. In this method, the patient lies face down on a specialized table that bends and stretches their spine into this gentle rhythm. And so the chiropractor is going to guide that movement by hand then, and it's going to help reduce pressure on those discs and nerves. Many patients say that this feels soothing, especially those with radiating pain from sciatica. During pregnancy, chiropractors may also use the Webster technique. This method supports pelvic alignment, and it helps to create more room in the pelvis. Expecting mothers often find it reassuring because it's very gentle and avoids forceful movements. Finally, some chiropractors focus on the upper cervical technique, which addresses the very top of the neck where the spine and the skull meet. These adjustments are extremely light and precise, often involving very minimal pressure. They're especially helpful for patients with migraines, vertigo, or other issues that's related to that head and neck alignment. So what makes chiropractic so unique is how adaptable it is. Pregnant women, for example, often benefit from the Webster or drop table adjustments that keep them comfortable while supporting that pelvic alignment. Elderly patients or those with osteoporosis may find a gentler option like the activator methods or flexion distraction are the safest and most effective for them. People with hypermobile joints often do best with a slower, more controlled adjustment that avoids overstretching, while our athletes typically respond well to diversified or Gonstead because of how much those techniques actually enhance performance. So even if you've had surgery in the past, chiropractic can still be an option. Adjustments can be tailored to avoid the surgical sites while still improving movement and motion and reducing strain in other parts of the spine. No matter the technique, the goal of chiropractic is always the same. It's to relieve pressure, it's to restore alignment, and it's to help your body function at its best naturally. And so if you've been living with pain and you're curious about which approach is right for you, the best way to find out is through a personalized consultation. Chiropractic care isn't a one-size-fits-all. It's care designed to meet you where you are, whether you're pregnant, elderly, active, or somewhere in between. You can schedule a consultation today to discover how chiropractic can help you move, feel, and live better naturally. So visit us at spinestop.com to get started.